I suspect everybody here has had an experience with one of our local hospitals. You can't not live without having some opportunity to be involved with our hospital system. And I'm sure everybody here, if you haven't been living in a cave, know that there's been discussions, long-term planning, expectations to develop a new, innovative, progressive regional hospital. Our next speaker is Ken Kozel. He's president and CEO of Shore Health Systems, and he is going to talk about these plans and talk about the economic benefits that come with the development of this new, innovative, and progressive regional hospital. Ken?
Thank you, Bob.
Thank you.
Susan, you can do that.
Let you call it up.
Great.
As we're calling up the presentation, boy, what a powerful speaker Secretary Gill is, isn't he? It's fantastic. A lot of passion there. And so my goal today is to first say thank you to many of you in the room who are partners of our healthcare system here on the shore. In one way or another, you have helped us become great. And I can't thank you enough for that support. And we're going to need you moving forward in the future because we've got a lot of plans. We do have that vision that Secretary Gill talked about. And I want to share with you today, so my goal is to, in about 20 minutes or less, go through a very, very complicated industry, which is making a significant amount of change. And I'm going to try to get that to you in 20 minutes so you understand what's going on and why, and then the vision that Shore Regional Health has to stay out in front of it. So I've got some slides I'm going to go through, and we'll get you there in about 20 minutes. So again, that's why we're here. We're going to talk a little bit about our strengths and our challenges in the industry in general, but the opportunities that we've got ahead of us. So let's start at the national level. How many of you know what the GDP of healthcare is these days? It's pretty high. It's about 18.5%. And the graph that this shows is that it's been climbing over the last several decades. And that's not a good thing. We're spending too much money on healthcare. And if you see the graph today, it's 18 and change, and by 2020, we're looking at over 20% conceivably. So 20 cents out of every dollar is devoted to national health care. Something had to be done. So at the national level, many changes were made very recently. And really, at the end of the day, you can boil it all down into one slide. It's really about the patient or in the center, or the community member in the center, and focusing on improving health, focusing on reducing costs, and focusing on providing high-quality care. You have to do all three of these things. If you only do 2 out of 3, you're not succeeding. So this is the national mantra. This is what healthcare has become. It's not about hospitals and inpatient beds solely anymore. It's about health and wellness and high quality. So how does that translate down to the state of Maryland? Maryland is a unique state where healthcare is concerned. We have many innovative ideas here in the state of Maryland, and one of the things that we've done over the last 5 years or so is worked with the federal government to do a pilot project here in the state. And that pilot project really says that we think we in Maryland can do a better job of controlling costs, of providing high quality care, and ensuring that we've got access to the community. So we are just about finished with the first phase of the Maryland Waiver. And the Maryland Waiver was an innovative project that just said, let's take a look at how Maryland provides care and show that we can demonstrate it better. The first phase focused on hospital-regulated business. There's 2 parts, regulated and unregulated. The regulated part is the hospital system, how we work within the hospitals. And that phase is just about ready to end. It ends December 31st of this year. But what you'll see is we have quickly launched into phase 2. We've done a very good job of doing those 3 things in the triangle that I shared, but now it's time to focus on a broader picture of healthcare in total. So the total cost of care is what the focus is for the next go-round. And this is a picture of our governor signing that second phase of the waiver with CMS, the Centers for Medicare and Medicaid Services, that really provide a unique way to provide health care in Maryland. So that will kick into place on January 1st of 2019. And what are we talking about when we're talking about total cost of health care? First of all, this pie chart pretty much sums it up in that the hospital systems represent about 54% of the healthcare costs in the industry. You've got professional claims at about 26%, And those are the doctor's visits, the testing that's done to support that, the pharmacy drugs that you're on, et cetera. Then you've got home health and hospice at 12%. So you can see from this slide that hospitals are the lion's share of the total cost of healthcare. So it really becomes our job to achieve this waiver that was just signed into law. So let's take a step down and we'll keep lowering the plane a little bit from national and state to what does that mean to Shore Regional Health? So I've got a couple of slides here just to familiarize yourself with who we are. And what you'll see here is Shore Regional Health is part of the University of Maryland Medical System. University of Maryland Medical System is in the light blue there, and you can see we're a 14-hospital system, 3 of which are on the shore. Maryland has about 25,000 employees in total, and an annual operating budget of about $4.5 billion. So we're part of that system, and as you can see, we're on the Eastern Shore, and we cover from Kent down to Dorchester County, our 5-county mid-shore region. And really, this is our focus moving forward. We're aligning ourselves with the national and state initiatives, and it's not about inpatient care again anymore. It's about health and wellness. How do we keep you and your family healthy and out of the hospital? So imagine running a business where you're trying to reduce the patients or number of encounters that you have. That's our challenge. And as you can see through the box, we've got ways to do that through enhancing care. Our responsibility is to make sure that you've got access to it. Also, making sure that we have the right services in the right locations. Investing in population health and wellness, which just means having more primary care doctors in the community, having more specialists in the community so you've got access to care, and then improving our facilities. We've got a number of buildings and facilities. All of our hospitals are in excess of 50 years old or more. So we've got a lot of challenges with providing care in those facilities while we're trying to improve health and wellness and reduce cost. So a little bit about Shore. Shore Regional Health has 2,500 team members as part of our family. We've got over 485 members of our medical staff that provide care in one of our facilities. We have over 400 volunteers who provide services in our hospitals and in our outpatient buildings. We've got about 187 licensed beds in total between 3 hospitals that we run from Kent down to Dorchester County. And you can see the number of visits that we've got, both admissions, ER, and outpatient visits. So a lot of activity going on within the 5-county region. This is a quick map. This is our service area, and there's a lot of symbols on there, but really these are the hospital and ambulatory locations for Shore Regional. You can see the red triangles represent the 3 hospitals, one in Chestertown, one here in Easton, and one in Cambridge. We've got a number of outpatient facilities. We've got an emergency center in Queen Anne's County near Graysonville, and we've got a number of services that we offer in Denton within Caroline County. So a lot of services going on throughout the 5-county region, and you'll notice that most of them are centered in population-centered areas within each of the counties. But this is the new Shore Regional Health. In addition to that slide, the new Shore Regional Health is focusing on your health and wellness. And where you see different symbols throughout the counties here, they really represent the new focus of healthcare. Wellness and education programs, getting out into the communities and educating our communities about cancer prevention, about keeping your child safe, about healthy living with diabetes, those kinds of examples, and you can see the red circles are all over the 5 counties. Additionally, we provide support groups, a number of support groups that talk about addiction and mental illness, cancer, heart disease, prostate cancer, a number of those support groups throughout the 5 counties, and then screenings and outreach. So important that we provide screening so we can get early detection and treat patients much more quickly and effectively. So this is part of the new Shore Regional Health. And as you'll notice, these are not so much in the population centers of each of the 5 counties. We need to get out and expand our services into all parts of the region. So what are some of our strengths, our challenges, and our opportunities? As I mentioned, we're 2,400 team members. That's part of our strength. That's our team. I wish I could have all of them up here on the stage with me and the providers that serve with us, because they are Shore Regional. And some of the things that our team provides is very high quality care. These are just some examples of accreditations that we have at Shore Regional Health that demonstrate the excellent care that we provide our patients. And they're national designations that I'm sure most of you are familiar with. So quality is key, and that's one of our major strengths in addition to our team. Some of the challenges, as many of you experience here on the Eastern Shore, It's a rural area. There's a lot of distance, there's a lot of geography between facilities and between services. We cover about 1,750 miles worth of geography within our healthcare system. Other challenges is improving access while we're reducing costs. With the geography and with the distance, it's hard to maintain a level of efficiency with the number of services that we offer and the distances between them. The global budget challenge is that hospitals today get a capitated rate. So we know how much revenue we're going to get for the services that we provide. Our challenge is how do we keep patients out of our healthcare system so that revenue can turn back into services for our system. So it's a challenge that we have to face, but it's something that we're starting to learn to do very well through partnerships that we've got here with you. Unregulated revenue is an opportunity that we've got, but it's a challenge to make sure that we're keeping up with our competition who's in the area trying to cherry pick some of these services that we offer. These are healthcare systems that aren't part of our region that come in and provide a medical office building with some specialist care that get revenue and take it back to counties outside of the 5-county region. So we're working hard to compete against them and make sure that the healthcare that's provided is provided by Shore in this region. And then with some opportunities, we talked about great quality care. Our opportunities is really linking the patient in every aspect of care that we provide. This slide shows you the continuum of what happens in healthcare, and the patient needs to be at the center of that continuum. With that, you can see a number of different encounters that the patients could have, from an emergency department to a doctor's visit, all the way up to hospital care. Our challenge is making sure that everything we do is connected for you, so that you're aware of what's going on, and everyone in this circle is aware as well, and can treat you effectively. So now I'd like to just take a quick 5-county tour and just let you know what we're doing. Now that you know a little bit about healthcare and about Maryland and about Shore Regional Health, let's talk about some of the things we're working on from an economic development perspective. I'll go county by county, and I'll start with Caroline County. One of our most important partnerships over the years has been with Caroline County. We have no hospital in Caroline County, but what we do have is an obligation to provide services for the patients and the community members in that county. And we work very closely with our elected official partners to come up with this concept, which is to build a medical office building in Denton. This is on 404 in Deep Shore Drive. If you've driven past it, you've probably seen it under construction as we speak. It's a great building that's going to provide a central location for healthcare services in the county. It'll have primary care, it'll have specialists rotating through, diagnostic testing, all in one location. We're also going to have telemedicine capabilities so that we can use technology as a means of connecting our local community to experts outside of the region. So we'll have all of that in that building and centrally located with a goal of opening in the spring of 2019. So the dates we're actually starting to lock in on is mid-February. We're ahead of budget. The construction timeline's going well. And this is really going to be a major project to support the needs of healthcare in Caroline County. And again, I saw some Caroline County representatives and just want to thank you for your support during this transition. Let's shift gears to Dorchester County. There's a lot going on in Dorchester County with Shore Regional Health and the way healthcare is being provided there. Our vision for Dorchester County is to actually close the hospital that exists today on the Choptank River. Our goal is to relocate our healthcare services and make them more centralized, make them more accessible for our community. The hospital on the Choptank is an incredibly old facility that needs to be replaced. But the question we ask ourselves is, can we afford and does it need a new hospital? And with the number of patients diminishing over time, intentionally, that leads us to this vision instead of a replacement hospital. This system will provide everything except inpatient beds. So you'll have an emergency center with 24-hour emergency services, and we see about 20,000 patients in the ED each year in Cambridge. It will have a medical office building adjacent to it that will have everything that I just mentioned in Denton. Primary care, specialists, diagnostic testing, all the acute care and rehab that you need for our patients in the community. And if you need inpatient care, our plan is to then transfer you to Easton. And I'll get into Talbot County in a minute. But this is an incredible project because it really ends up being a win-win for a lot of different constituents. First, the hospital system. We have to replace the facility there, and this is the best solution for the community and for us. Second, the redevelopment efforts going on in Cambridge right on the Choptank. If we can work out an arrangement where that property that we're on today becomes open for business, then that creates the gateway to Cambridge that everyone's trying to envision and create. And we want to be part of that vision. So we want to work with the county to try to transition, excuse me, to transition our property, excuse me, to transition our property to something that the city and county can redevelop. And then third, the economic boost to this vacated shopping center. It's been for a number of years. Our goal is to use the Cambridge Marketplace Shopping Center and revitalize that part of the community as well. So it's trying to find those three wins for the community, for the hospital, and for the city and county that we're doing here in Cambridge. And as you can see, we've filed all of the applications for this process. We're in the process of having those applications reviewed, and with the goal of opening our doors in the spring of 2021, so right around the corner. And again, this is just a Google Maps of where we are today, right on the Choptank River. And the space that we own there is about 15 acres, and there's a number of parcels around the hospital property that is owned by the city and county. So it does become a very nice economic engine for the community if we can transfer down to the bottom of that slide, which is where Cambridge Marketplace is located. So that's our goal, that's what we're working to, and our vision is to make that happen. Shifting gears to Kent County, we do have a hospital in Chestertown, and that's a picture to the top right of our screen. And in the bottom left, you see our medical office building there. So we provide full-service acute care hospital services in Chestertown, from emergency care to inpatient care, and the medical office building supports that community with primary care, diagnostic testing, and a facility for specialty care as well. So this is housed in Chestertown, and it serves all of Kent County and northern Queen Anne's County. Shifting gears to Queen Anne's County, many of you have probably seen that right on Route 50, but we don't have a hospital in Queen Anne's County, but what we do have is an emergency center, and that's the building to your upper right. That emergency center sees about 15,000 patients a year, and the medical office building, which is adjacent to it, has the same services that I mentioned in other MOBs, all serving the community citizens of Queen Anne's County. And then finally, Talbot County. Our vision for this community is to replace the hospital on Washington Street and relocate our facility and services out to property that we own between the community center and the Easton Airport. This is one of the major projects that we're working on. This is our regional medical center. We offer most of our services in the hospital on Washington Street today, and our goal and intent would be to transfer all of those regional services to this new hospital in our property. Very complicated, very complex process, but we have started the regulatory review for this to take place. And unfortunately, that regulatory review is going to take about 2 years to give us the yes or no answer and to tell us how much additional funding we'll get with this. And then there's a 3-year construction timeline that goes with this project. But at the end of the day, if things go to plan and if we realize our vision, we're looking at opening the doors of the new hospital in the summer of 2024. This is going to be a $350 million project. It's going to have all the bells and whistles that new hospitals have, all of the services that we offer today, and we're going to continue to enhance those services to meet the needs of the community far into the future. So what does that mean to the region, Shore Regional Health, and the impact that we have? And as you can see, we generate over $488 million worth of economic activity. And you can see some of the numbers here with regard to direct employment. Again, 2,500 team members. Indirect impact of 780, resulting in local jobs here in the region. And then another 830 additional local jobs through the induced impact. And finally, with the state and local revenue tax, with everything that we provide and the employees that we have and the services that we offer, over $19.5 million. So a lot of economic impact with the healthcare system, and very important for our region. But at the end of the day, what this is all about is it's about healthcare, and it's about patients in our community, and it's about Shore Regional Health being the healthcare system in the 5-county region, caring for our citizens. And what we like to say at the end is just where the health of the Eastern Shore comes first. So hopefully this was a round table discussion from the national level to the state level to what's going on at Shore, and I look forward to your questions a little bit. Bob?
Thank you, Ken.
Thank you.
Ken, thank you. A little while ago, got involved with the medical system and served on the University of Maryland Medical System Board of Directors. Didn't know anything, and my whole focus was on the medicine, healthcare, which is where it should be. But the thing that amazed me most was the business of healthcare, and the employees, the benefits, really is incredible. And I'm sure you all have even a better appreciation of that after Ken's presentation. I did want to mention that certainly feel free to get up and move around as you need to. We've got a full program this morning, and we're just going to keep rolling, but you're certainly welcome to move around as you see fit.